But first, let's bring in my panel, Shadow Environment Minister, Senator Jonathan Duniam, and columnist with The Spectator, Terry Barnes. Well, gents, thank you for your time. American Ram, those great big utes or pickup trucks. I went to school in America, that's what they really are. Very popular in Australia now, but the company that's importing them, Attico Automotive, is warning that costs will increase by $15,000 plus if Labor's new emission standards go forward. The bloke who runs it, Roger Zagorski, says, Chris Bowen, you are kidding yourself with these new standards, which says to me, Senator Duniam, they've got to back down on this. We had those reports too in the middle of ASEAN that the Thai Prime Minister was raising concerns about these emission standards because it'll impact exports from Thailand into Australia, of course. But the Albanese office says, no, the issue wasn't even raised. So what's going on here?
Yeah, look, I'd be embarrassed too if I were the Prime Minister and his office. The Thai Prime Minister is on the money here. Thailand, major manufacturer, as you say, Peter, importing about 260,000 cars a year into this country. A lot of them Fords, Mitsubishis, Mazdas, many of them going to be impacted by this new car tax. So what the Thai Prime Minister said confirms everything we've been talking about, which is cars will be more expensive, which means people won't be able to buy them. And this is everything Labor have been denying. So, of course, the PMO are doing their level best to go, no. Nothing happened. There's nothing to see here. It's all good. And we understand people are doing it tough, yet they proceed with this ridiculous tax. It's time for them to fess up, admit to what was discussed in the meeting, and also admit to Australians that cars are going to be more expensive and it's not going to help in this cost of living crisis.
Terry, you're a health boffin of some renown, so timely that you're here to talk about private health insurance. We had that increase, obviously, yesterday, announced by the government. But we find out today in The Australian that out-of-pocket medical expenses, they've gone up by almost 40% over the last 3 years. There's concerns, too, that a whole lot of the private hospitals are, basically against the wall. We've heard that there's 16 facilities that have announced closures or at least having their private status revoked since last year. What's going on here?
Well, Peter, I think there are three definite things in life: death, taxes and private health insurance premium increases. But look, and I don't begrudge the government from running a ruler over the increases, but I do wonder about the timing of the announcement after the Dunkley by-election. Oh, please. But when you think about it, private health insurance pays for services. It pays for hospitals. It pays for doctors and surgeons. It pays for prostheses and medical devices. It pays for other services like optical and dental. And all of these things, all of these services and bits and pieces actually rise in cost at a greater rate than general inflation. So premiums have to follow that. And certainly I think the health funds do everything they can to keep them as low as possible, and governments on both sides of politics actually do their best to run the ruler in a tough way. But when it comes to private hospitals, they are doing it tough. Some of those businesses are struggling a bit, and certainly some of those hospitals are struggling or closing. But you've got to bear in mind that the legislation that was put in place by I think it was the Keating government back in 1995, and I worked on that at the time, actually protects private hospitals from health funds driving too hard a bargain in negotiating contracts. And if they are making commercial decisions about the services they offer or where they place these hospitals and day procedure centres, you can't blame the private health insurers for that. So I think it's a two-way street. Insurers depend on the hospitals to provide the services their member wants, but the hospitals depend on the insurers. So that relationship never works well. They never seem to realise that they are in this together, and that's part of the problem here.
John, I want to talk about offshore wind. We read today that there's a whole lot of foreign companies, yet more foreign companies, about to get the go-ahead for a big project expansion in Victoria. 90% of these turbines are made in China, so the jobs are in China, the profits are in China. There's money going overseas to these foreign companies when they get their licences in Australia to operate here, and I'm sure plenty of subsidies go their way. But there's nothing in these contracts about what happens to these turbines when they get to the end of their life in 15 years. Do we just leave them to rust in the sea? I am so worried about offshore wind projects.
And you're not alone, Peter. Every fisherman and woman I speak to has similar concerns as well. this big green push, the push for renewables to be at our front and back doors by tomorrow by this government, isn't accompanied by any sense of reality when it comes to the real environmental impact of these wind turbines and the whole of life. If you look at it from construction to decommissioning, how you dispose of every element of the wind turbine, it's not accounted for in any sense, including when it comes to carbon emissions. On your program, we've seen the evidence previously of what they do with terrestrial wind turbines at end of life. They just sit them out in a paddock somewhere. That is not good environmental management. So I say to those proponents, then if you're serious about environmental improvement and getting better gains for the planet and the world we live on, then actually come up with a real plan to deal with these issues. Be honest with Australians and people across the globe about what environmental impact we really have from wind turbines. But I have fears, like you just outlined, these things are left to rust because no one can see them. It's not our problem, but it will be one day, and we need to actually own up to that.
Gents, I'm out of time. Thank you very much. Catch up with you both next week.